Hi, and welcome back. Today, I will be talking about various types and causes of shoulder pain. There are several different causes of shoulder pain, and the treatment of these can vary depending on the underlying cause and symptoms presented. Shoulder pain is not usually due to anything serious if there has not been an injury or other symptoms with it. The most common cause of shoulder pain is muscular strain from a mild injury or awkward position while sleeping. This type of pain should resolve within 2 weeks with home treatment. If the shoulder pain does not improve after 2 weeks or there are other symptoms, there may be other underlying causes for it. If the pain lasts weeks or months and there is stiffness with it, this could be due to frozen shoulder, osteoarthritis or rheumatoid arthritis. Frozen shoulder is a common cause of shoulder pain, and it is characterized by pain in the shoulder that can be worse at night and while sleeping, and stiffness that makes it difficult to move the shoulder. The exact cause of frozen shoulder is not clear, and it is thought to be related to inflammation of the tissue around the shoulder joint. Previous injury or surgery and diabetes can increase the risk of getting frozen shoulder. Frozen shoulder can take several months or years to get better. The treatments for this condition include painkillers, steroid injections, and physiotherapy. Osteoarthritis is the most common type of arthritis. It is due to wear and tear of the cartilage in joints that occurs over time. The common symptoms are pain and stiffness, difficulty moving the shoulder, and more rarely swelling, tenderness and cracking sound when moving the shoulder. Osteoarthritis is a chronic condition and there is currently no cure for it. Mild symptoms can be managed with simple painkillers, regular exercise and physiotherapy. More severe cases may require stronger painkillers to control the pain, or surgery to replace the damaged joint. Rheumatoid arthritis is another chronic condition that could affect the shoulders to cause pain, swelling and stiffness. Unlike osteoarthritis, rheumatoid arthritis is an autoimmune disease that causes inflammatory changes in the joints. The treatments for rheumatoid arthritis include conventional painkillers, specialized medicines, physiotherapy, and surgery for very severe cases. Shoulder pain that is aggravated while using the arm or shoulder could be related to tendonitis, bursitis or impingement. Tendonitis is inflammation of a tendon after an injury, leading to pain, swelling and stiffness. This can be treated at home with painkillers if necessary, and it should get better within 2 to 3 weeks. Bursitis is inflammation of bursa, which are fluid-filled sacs that cushion the joints. This can cause pain, tenderness, redness and swelling of the shoulder. This can be treated with rest, ice packs and painkillers. Shoulder impingement is a condition where a tendon inside the shoulder becomes swollen and rubs against tissue or bone. This can lead to pain while lifting the arm. It can be caused by injury, irritation, or wear and tear. The treatment options for shoulder impingement are painkillers, physiotherapy, steroid injections, and surgery to prevent rubbing on the tissue or bone. This type of pain usually gets better in a few weeks or months. If shoulder pain is associated with tingling, numbness, weakness in the arm, clicking or locking, this could suggest shoulder instability or hypermobility. Hypermobility is characterized by flexible joints. There can be pain and stiffness, recurrent sprains and strains, frequent dislocation of the shoulder, and poor coordination. There is no cure for joint hypermobility, but the symptoms can be improved with painkillers and physiotherapy. This condition usually affects children and young people and often gets better with increasing age. Shoulder pain that is sudden and severe could be due to fracture or broken bone, shoulder dislocation or ruptured tendon. This type of pain requires more urgent assessment by a doctor or in the hospital. For simple shoulder pain, it is recommended to stay active and perform gentle exercises, to sit with a cushion behind lower back, to rest the arm on a cushion in the lap, and to take painkillers if needed. It is not advisable to stop using the shoulder completely, to put exertion or a lot of weight on the shoulder, or to perform strenuous exercises that could cause further damage. The general advice is to see a doctor for further assessment if shoulder pain does not resolve after 2 weeks, or if there are other symptoms such as swelling, stiffness and numbness. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first.